This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. Finding out the Affordable Care Act isn't so affordable that you can't keep your doctor or you have to pay an annual fee just to be a member of a practice? That preventive care really means take this pill for the rest of your life? I'm Dr. Tom Roselle, and one day I will show you how to take control of your health and avoid a lifetime of drugs and probable surgeries. Join me for Ageless Health 2014, a day that will change your life forever. For details and registration, visit agelesshealth2014.com or call 703-698-7117.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your phone calls on any aspect of health that you'd like to talk about. Number here is 888-630-9625. That's 888-630-9625. Love to talk to you. Let's kind of get into the groove of, why you're still having the problems that you're having and you think you're doing some things right or preventatively, but it's not working. Well, here's an opportunity. Let's get it done. I've got a whole lot of things I want to talk to you about and a couple things to tell you about. First of all, I want to let you know that after the program today, immediately after at 2 o'clock, I will be at the Fairview Park Marriott Hotel, and I will be presenting a small topic on Ageless Health. Ageless Health is our umbrella, and by the way, Ageless Health 2014, our all-day presentation conference seminar, is only 2 weeks away. We're going to talk a little bit about that today, but immediately after the program, 2 o'clock, I will be at the Fairview Park Marriott Hotel, and I'm going to give a kind of a snippet of what we're going to be doing at that same hotel on October the 18th. So join us. This is a freebie. You guys can come. I'll be in Salon number 2. And be my guest. I'd love to meet you. I'd love to shake your hand. I'd love to talk to you. And if they throw us out of the room, we can meet in the hallway and we can talk there. But anyway, I'm going to talk a little bit about Ageless Health as it relates to epigenetics. And it's a big term. Many of you have heard about it. And epigenetics is basically this. It's environmental impact on what happens with your genes. So many of you say, well, I have a genetic pass-through. I have genetic heart disease. I have genetic this disease. My father has this. My grandmother had that. Everybody in my family did this. Well, there's a difference between a genetic pass-through and a familial pattern. Now, what does that mean? Well, genetics means it's locked in your genes. Familial means if you walk like a duck and talk like a duck, it's a duck. But even if you're a dog and you grew up in a duck family, you're going to have the characteristics of a duck. So how does that impact each other? Well, you can have an underlying predisposing situation that never comes to light. It just sits there. And unless you have an environmental stimulus to bring it about, you're not going to trigger the presence of that situation. We know in study of science and genes and genome therapy and manipulation that 80% of these so-called pass-through gene expressions can be changed because of environmental stimulus or lack thereof. So if you do certain things in a certain way that are productive and supportive and helpful to you, guess what happens? These guys don't get expressed. If you do the dirt, the sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, my mantra. If you're stressed out all the time, if you're limping around with injury all the time, then these underlying genes can be activated instead of being modified and being retarded. See, you've heard me talk about all this nonsense going on with Monsanto and, genetic modification and so forth. Well, there's this expression that you're going to hear. It's called junk genes or junk DNA. And it's basically a dormant expression of the DNA. Your body's done a great job of hiding it, but now through manipulative modes, because we're playing with these gene sequences and expressions, these guys come to life, and you end up with all kinds of problems that you otherwise wouldn't have thought were possible, but you got them. How'd you get them? Well, you can manipulate these DNA sequences, these proteins as they may be, and they are called, and they're activated quietly because of your exposure to the stuff that you do or don't choose to do. if you're eating a great diet and, it's organic and it's tons of vegetables and seeds and nuts and only lean meats and fish and proteins and so forth, but you're screwing up the rest of your life. Like, you're constantly stressed. You don't do anything to learn how to handle those things. Guess what happens? These genes now have a greater tendency, even though you're doing good things biochemically, to express themselves. You live in Washington, D.C., or in the Washington metropolitan area. Talk about stress? Give me a break. I mean, there's not one of you out there listening that is without the input, either directly or serendipitously or by chance of walking by somebody who's all cranked up. And now you got to deal with it, right? You have to learn how to handle that exposure, or sometimes the compounded effect of multiple exposures because of the talking heads on television. We're getting up close right now to election season. Everybody's talking about, who's going to fall, who's going to, get in place. Will they do anything anyway, even if they get into place? Talking about Obamacare and the impact that it's had on your companies, or soon to be on your companies once it goes into full effect. You think those aren't stressful conditions for all of us? Talking heads say we may be in the worst recession of our times coming up soon, and the stock market's going to fall around your toenails, and to do this and to do that, and oh my God, we have Ebola, and so many people died. Somebody talked to me about that the other day and said, what about this Ebola thing? And I said, well, what about it? I said, it's a hype. And I said, it's not that it's not dangerous, but it's a hype. It's been, jacked up quite a bit. I said, do they talk about the fact that over 14,000 people die of aspirin every year? 14,000 plus aspirin every year. With children being given aspirin with fevers, and it's called Ray's syndrome, or the bleeding that affects and causes strokes and also causes heart attacks. We don't talk about those things, but we're going to talk about Ebola. And why are we going to talk about Ebola? Because we have to protect ourselves for something that is so scandalous and then take advantage of it, so somebody's going to make an antidote for it and get very, very wealthy. Okay, that's my opinion. Okay, obviously that's, Tom Roselle sitting here telling you these things, but think about it for a second. When you really look at the playing field, we talked about ISIS the other day. There's a whole bunch of us sitting around and we were talking about, oh my God, I can't relax, I can't do this, they're coming to this country. And the truth of it is that we've done some really stupid things, and the emotional state that goes along with that is really jacking us up. But if you go back historically, millions upon millions upon millions of people have been butchered at the hands of insensitive despots, starting, with guys like Adolf Hitler and Joseph Stalin, and it goes on, Idi Amin in Africa, and it continues today. So how is this any different, with the exception that it's more far-reaching perhaps, and we're not isolated anymore, but it's been going on. So you have to be careful of the emotional rhetoric that is placed behind the scene and how it affects, and the whole point of my monologue here is how it affects you and how you handle that in your life so you don't express the pattern in a health condition. We're talking about epigenetics. That's the emotional piece, the biochemical piece. How about those of you who've been hurt? You don't exercise. You're overweight. You're at a place in your life where you should do something about it, but you don't. We're such an overfat society. It's unbelievable. Take a look around. Walk down the street. Take a look at yourself. Look in the mirror. Say, is that okay with you? I said, well, you come up with every kind of excuse in the world that suggests that maybe, you should do something, but, you just don't have the time. You don't have the opportunity. The things aren't there. It's not easy for you. It's not going to be, it won't be easy either, or, at least maybe it'll be less easy, or it'll be not a problem when you're laying horizontal. God forbid you're in a hospital with somebody giving you something in a feeding tube. Ageless health, what does that mean? And that's the question that I want you to consider as we go through the program today. Ageless health. It is your birthright. It's something that has been given to you that you set aside. This afternoon, when you come to my program at the Fairview Park Marriott Hotel, Salon number 2, we're going to talk a little bit about that. I'm going to put the pieces together. I'm going to explain it more in a very succinct format so you really get it. And I'm going to answer your questions straight up. But today, here at the studio, as we always do at Sundays at 12 o'clock, we're going to talk about you and the problems that are besetting your health or taking it away from you. So if you have a question, you have something that you want to kind of air for us, 888-630-9625. That's 888-630-9625. If you'd like to get a hold of us outside the program, you can go to our website, rosellecare.com. That's ROSELLECARE.com. Send us a note. We'll get back to you. If you need someone to talk to, call the office at 703-698-7117. And tell my staff that you'd like to talk to one of our doctors who are extraordinarily capable in putting all these pieces together. And they'll be happy to talk to you on the phone without any trouble whatsoever. Give us a call. I'd love to do that for you. Let's talk about something called obesity. Okay? Like you're way too fat already. Or you don't even realize that you're fat, you're skinny, but you're a skinny fat person. Like all that stuff is inside of you, building up around your organ systems and your intestinal system and so forth, and just it's the insulation inside. It's not that fat stuff on the outside that everybody can see. It's the stuff inside that's going to kill you. So guess what? Obesity is now a formal disease process. It even has a diagnostic code. Isn't that amazing? So, it's, when you look at the doctor's chart and he says you're like way too fat now or morbidly obese, there's actually codes for that. So you can tell your insurance company that you've been diagnosed as being too fat. The American Medical Association formally labeled obesity as a disease about a year and a half ago, almost a year and a half ago, about a year and 4 months or something like that. But most of us thought that, this had to do with new research or, recommendation from some stupid committee that was coming out and so forth. However, what we found out is that the decision went against all kinds of recommendations and went against a very strong recommendation by somebody called the Council of Science and Public Health. This is the formal outfit that tells everybody, what things are and the guidelines and yada, yada, yada. Anyway, the decision comes at the same time that there were 2 new drugs on the marketplace for obesity. Gee, go figure. Isn't there a point A to point B to point C to somebody's getting paid off? Well, guess what? There's a drug called Belviq, B-E-L-V-I-Q, Belviq, and this one I can't even pronounce, is Qsymia, Q-S-Y-M-I-A. And they're out in the marketplace. And, the old saying, follow the money, follow the money. Follow where the stuff's coming. This goes back to the Ebola thing I just told you about, too. Follow the money, honey. There's a link. There's a link from point A to point B, and don't be duped on this stuff. First of all, this situation labels more than 37% of adults and 1/5 of all kids as a diseased condition. That's huge, because that's how many of us are over fat today. I mean, we just, not watching it, right? That's like unbelievable. Let me give you the numbers on that. That's 150 million new patients to the allopathic community. 150,000. Not to put you on a diet, not to recommend to get off your butt and put your iPads down and get outside and start exercising, but in fact, here's a drug that'll make you thin, or make you at least not as fat as you were. If you notice I'm getting a little excited about this, well, that's just me being me. This is me doing what I do best, letting you know that there's a problem out there. Here's the problem. Even though somebody is fat, it's tough to diagnose obesity because it's really based on the percentage of body fat and something else that we call basal metabolism, how many calories you're actually burning, and there's a whole exchange for that. And obesity actually comes in all shapes and sizes and conditions and so forth and so on. And there's a lot of people that have really high basal rates, and their outside body looks fat and their inside body is skinny as somebody else's. So you have to do it the right way. But the problem is that a third of us, more than a third of us, are in trouble. And we're in trouble because now we're going to be solicited by the big marketing guys. And they're going to tell you to go in and see your doc so you can be put on these 2 new drugs, Belviq and Qsymia. I don't know about you, but, doesn't a walk and throwing the extra donuts out and getting rid of the sodas and things like that sound like a whole better place to be, particularly when you start looking at the side effects on some of these things. We're coming up for a break. Don't go away. I got a lot more to tell you. I'd love to take your phone calls at 888-630-9625. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Finding out the Affordable Care Act isn't so affordable that you can't keep your doctor or you have to pay an annual fee just to be a member of a practice? That preventive care really means take this pill for the rest of your life? I'm Dr. Tom Roselle, and one day I will show you how to take control of your health and avoid a lifetime of drugs and probable surgeries. Join me for Ageless Health 2014, a day that will change your life forever. For details and registration, visit agelesshealth2014.com or call 703-698-7117.
105.9 FM and AM 630, Washington's Mall, WMAL, where Washington comes to talk.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, waiting to take your phone calls on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied. Well, let's see if we can do something about it. Here's an opportunity. Call me, 888-630-9625, 888-630-9625, or join me this afternoon, at the Fairview Park Marriott Hotel in Falls Church. There's a big event going on, Pathways Lifestyle Seminar Conference, thousands of people, lots and lots of different vendors. Anyway, I'm going to be there simply because of the fact that I'm going to be presenting at 2 o'clock this afternoon, immediately after the program, and we're going to be talking about some of the concepts, actually one of the concepts of Ageless Health, and I'm going to ask you questions like, what is Ageless Health to you? What does it really mean? And, what can you begin to think about when it comes to that capacity? See, you were given everything that you need to have, and coming up October the 18th at the same hotel, by the way, but it'll be all day. It'll be all of us. My entire staff will be presenting Ageless Health 2014. So this will give you an opportunity to get a little snippet, freebie, a snippet to see whether or not you even want to join us on the 18th. And by the way, if you don't, you are out of your ever-loving minds, because this is a day that will knock your socks off. It's an amazing opportunity for you to get all the information that you will ever need to begin the process to reclaim who you are. Learn how to take charge of your health and wellness without drugs, without the impediments that, Fifth Avenue would like to put into your body. Join us. That day is going to be, I'm going to give you, on October 18th, I'm going to give you a step-by-step plan, if you will, to take advantage of the opportunity to change everything for yourself, for your family. But, ask yourself the question, are you really ready to take control of your health? Are you ready to create a wellness capacity that is something that maybe up until now that you haven't even thought about? Are you ready to take that one step? Well, if you are, then go to our website, go to rosellecare.com, scroll down, hit the Ageless Health ad, and go in and register. But do it now. You have less than 2 weeks. It's 2 weeks from yesterday. Time passes, friends. Don't put it off, and don't say, I should have been there, and I heard it was so great. It is. It's over the top great. People say that there's so much information, it's like drinking from a fire hose. And you're going to have all kinds of things. You get to take home all the data. Every presentation is yours to keep forever. And you're going to be given a gift bag with all kinds of different things. You get, as I said, the lecture notes. You're going to be registered for $1,000 worth of health care. $1,000. That's our gift to you. Whoever wins it, you got to be there at the end to get it, but you're going to get it. And there's raffles and there's all kinds of things. Our vendors have given us things to give away to you. This day is fantastic. You get an organic lunch. You're going to get a small glimpse of somebody who I think is absolutely amazing, Ann Abernathy. Ann is just this amazing human being that walks this planet. 6-time Olympian. In the luge, this woman has broken, I think, every bone in her body. And a couple years ago, while she was writing different articles on Olympics, she was writing an article on archery. And she said, I was a pretty damn good archer. But she hadn't picked up a bow since she was in college. So she went out and got her coach. Now she's in her 50s at this point, her late 50s. And she starts training. And she just qualified. And we're going to see her at the 2016 Summer Olympics, her 7th Olympiad. You want to see somebody that's powerful? This woman is absolutely a motivation for everyone. I look at Ann, I treat her, she's a patient of mine, and I say, oh my God, how do you do this? Why do you keep pushing? Well, it's because she wants to get away from the idea of what do you think, why do you do what you do at your age? Take this pill for the rest of your life. And her story is significant. Ageless Health 2014, you can go to agelesshealth2014.com or go to rosellecare.com and register today. And we'll have, I promise you, this will be a day that you're going to learn things about that fat we're talking about right now, that belly fat, why it's there, how you can get rid of it, and doing very simple things. Are you losing your mind? Cognitive dysfunction? You walk into the room, you wonder why you were there, or you get confused. There's ways of reducing that problem. We're going to give you tools to deal with allergens. This is a bad allergy season. Many of you already know that. And once you like to be able to fix it and turn it around once for all, we're going to have a Tai Chi demonstration at lunch besides your organic lunch that we're going to give you. How little guys, little problems, things that you kind of overlook become major monumental things over time, and what to do about them now. And then how about what lab tests to ask your doctor about? Wouldn't you like to go in and know a little bit more than your doctor does about, what he really should be doing when you go in for that physical with that, thank you exam, I call it, at the end of the year? Well, there's very specific things that he should be running or she should be running, and we're going to let you know about those, and we're going to tell you what to ask them for. We'll be right back after the break. Don't go away. I have a lot more to tell you.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm in studio. I'd love to take your phone calls. It's a beautiful, cool fall day today. You need to get outside and walk around a little bit. The leaves are starting to change. It's stunning. It's really pretty outside. Now, how many of you actually walk every day? I mean, just actually walk. Did you know that if you walk 2 miles every day, it decreases your risk of dying from any disease process by 50%? Just 2 miles. That's it. Get out and walk. Do something for yourself. Start making some changes slowly. Piece by piece, make some changes. And see what happens. See if you get off the medication. See if you make a difference in your health overall. We're going to come back and we're going to talk a little bit about sea salt versus table salt and the differences. And because there was an article out there that says, that, and studies are saying that salt kills you, increases your blood pressure, causes heart problems, and hardening the arteries and so forth. Well, actually, the article should have said too much table salt, sodium chloride. We're going to talk about sea salt in comparison a little bit later on in the program. But right now, I do want to get to the phone calls. 888-630-9625. That's how you find us here. Love to answer your questions. And don't forget, right after the program, 2 o'clock at the Fairview Park Marriott Hotel. Love to meet you, shake your hand, and answer your questions. Susan, how can I help you? Thank you for calling.
Oh, thank you. Last week I spoke to you about a blood thinner called Epigenetic.
Yep.
And I told you that I had colitis and I had an ablation done, AFib,
right,
edema. But I neglected one thing. I haven't taken it yet at all because I'm afraid, all right? I didn't mention that I had also peripheral artery disease in my legs, the start of it. Would that make any difference whether to take the Epigenetic or not?
Well, they all have side effects. Here's my take on this. With an ablation, trying to regulate the heartbeat and get it to normalize. The reason that they're going to give you blood thinners and they're going to give you all types of medications like that, and some of them will give you statins, some are going to put you on aspirin and so forth, is try to stop the blood from clotting so you don't throw a clot and have a stroke or have a heart attack, right? Or have a problem and jam up your lungs.
Right.
So the problem is, you're a smart lady. You go into drugs.com and you put the medication in there and you see what the side effects are and you see what the compounded side effects are of many of these things. And you say, what's worse, the problem that's progressing or the drugs that are going to take me out anyway over a long period of time?
Right.
So here's the deal. With any kind of blood thinner, my opinion, based on, 38 years of clinical practice, is that there are better ways of changing the body's environment. Let's talk about blood supply. Let's talk about the heart and so forth, because actually it's a really good example of what I want to get across to you. Every tissue in the body, every organ in the system has a nerve supply. It comes from the brain and the spinal cord, 31 pairs of spinal nerve roots, 12 cranial nerves, and they come out and they attach to organ systems and they attach to muscles. That's why you can do what you do. Otherwise, it's like taking a dimmer switch on the wall and you push it down. So you have that neurological input. You have blood supply that nourishes these tissue. Even the blood vessels themselves have to be nourished, and they have to be nourished by the blood supply. Okay? So you have those. You have an energetic system that's made up acupuncture energy pathways. There's 12 pathways that flow one to the other to the other. They're redundant. One side has 12, the other side has 12. So if any of these things misfire, then you're going to have that target organ. In this case, we're going to talk about the heart. That's going to misfire. Now, the heart itself electrically has nerves that come from the spine, in between your shoulder blades and up to the base of your neck. It has a nerve from the brain called the vagus nerve, and then it has the pacemakers within the heart. That's where that oblation was directed. Okay, but the rest of it hasn't been taken care of. The heart, the muscles of the heart, have to have enough minerals and enough nutrients to fire properly. It's called polarization and depolarization that causes these muscles to work. Things like potassium and magnesium and sodium and so forth have to be in balance. So just to say, take these medications and not to explore these other things, in my opinion, is a detriment. So what has to be done? So first of all, blood thinners, you have a lot of different omega fatty acids. You have your fish oils, you have olive oil, you have flax oil, you have borage oil. All these things have a tremendous impact in keeping the blood thin without the side effects that many of the blood thinners have. And but you need to have somebody who knows what they're doing to be able to take you through the process. Peripheral artery disease. You have to look at it. Is it a peripheral artery disease, or are the arteries losing the integrity, the capacity to be able to pump the blood back into the upper part of the body? So then you're dealing with muscle. You're dealing with valves that are within the arterial system itself, and you have to look at the muscular system of the person. You have to look at the dietary patterns, all those things that we've been talking about.
Yes.
And if you fix those, you can change virtually 80% to 90% of anything that's going on. There are times when you need emergency intervention, but we're talking about a functional problem that in most cases can be dealt with much more effectively using lifestyle change, dietary modes, and nutritional supplementation.
Yeah.
Okay?
I'm eating a lot of fish. Every night practically, salmon, catfish.
Okay, make sure your fish is wild caught. Do not eat farm raised fish. What is that? Make sure it's wild caught fish.
Yes.
Not farm raised. If you're eating you have to eat a lot of vegetables, and they have to be organic, so you don't have all the pesticides and the junk on them.
Yeah, I'm afraid to eat a lot of vegetables because of the I have ulcerative colitis too.
That tells me that your immune system, your IgA antibody reaction is suffering. Also, your short chain fatty acids aren't where they should be. There's one called butyrate that if it's too high, it's going to increase your bowel irritability, or if it's too low, it's not going to protect the intestinal tract.
Spell that? Would you mind spelling that for me, please?
Butyrate, but you can't go just take butyrate. You have to find out why it's missing. Butyrate is B-U-Y.
Wait, let me write it down.
I'll tell you what, the easiest way to do this is this, Susan. Send me a note at rosellecare.com. I'll tell you exactly what the ratios are, and I'll tell you how to find it and so forth. I really appreciate it, and, listen, you have a lot of things that you can do to make a difference. Walter, how can I help you, sir?
Yes, doctor. I've got Bell's palsy, and I don't know how to handle the treatment for it. And also, I need some kind of a pain supplement because it hurts a lot.
When did you come down with it?
It's about 9 months ago.
Okay, so what we have found historically that will work with Bell's palsy. Bell's palsy can be show up for a lot of different reasons. It can be a result of the temporomandibular joint being jammed, so meaning that the vertical dimension's not holding the way it's supposed to. It can be viral. It can be an infection that is deep into the the root of it, or where the nucleus of the nerve comes. So Bell's palsy is going to affect the trigeminal nerve as it comes out, and one's a superficial nerve and one's a motor nerve. The superficial has sensory chambers. The deep one is the motor function. That's the one that's being affected. So you can't, your face is flaccid compared to the other side. Things like B12 and folic acid at very, very high levels work well. Vitamin B1 at very high levels. Arginine, which is an antiviral. High levels of vitamin C. L-lysine is as well. Arginine you want to skip on that one, because you get too high, you're going to get yourself in trouble. So forget I said that. L-lysine is going to be something that you can do. But again, you need somebody to monitor dosage. But the thing that we found that works in conjunction as the leading edge on this is acupuncture and low-energy light laser. You combine that with the specific nutrients we're talking about, and you can get huge turnarounds in Bell's palsy within a very short period of time. It works, and we've had hundreds and hundreds of cases over the years that we've treated. 38 years of what we do, that makes a difference. But you've got to change the environment. You've got to get the IgA antibody up. There's a tremendous depletion of immune protection that's allowing that virus to express itself. The thymus gland is involved in all of this, but you have to find out what's taking place. Many patients who have had shingles vaccines suddenly come up with Bell's palsy, and it's because it's the viral component that expresses itself. And so you have this low underlying virus that's there that was injected in your body that you don't have the immune response to be able to protect yourself from. So if we can help you, please, Walter, give us a call. We're more than happy to, do what we can to lead you in the right direction. 888-630-9625. Love to talk to you on any subject that you have in mind. We're hitting a lot of different things today, and these are conditions that you don't have to suffer with, and you have to get to them soon, because in a case like Bell's palsy, where you have facial paralysis that's due to one of the things that we talked about, if you don't fix the underlying cause, in the case of, let's say that it's the temporomandibular joint, if you don't get that vertical dimension to open up, that nerve is being crushed constantly. That's coming out in that opening, and subsequently you're going to paralyze the facial apparatus. Second, the second piece, as we talked about, is viral. Viral can come about for a lot of different reasons, and it's the same thing. Medicine says, well, we're going to give you the vaccine for shingles so you don't get the vaccine. Well, they're putting the same virus in your body that's going to give you the problem to begin with, so they're trying to stimulate your immune response. That's the whole idea. Stimulate the immune response so you can fight it, but we're going to give you the stuff to do that. But if you don't have an immune system to work with to begin with, you're going to end up seeing the problem in a lot of different ways. And this is one of them that if you do your research, you're going to take a look and see that Bell's palsy can come about because of something like that. Botox, applied improperly, has a lousy side effect of causing paralysis, and it's a neurotoxin. It can cause a permanent situation to occur. Be very careful. Botox is a neurotoxin that is not to be taken lightly, but it's out there and everybody's selling the damn thing and trying to get you to do what you need to do. So if you've had it long enough, like Walter has, you've got to start doing something immediately. Otherwise, there's going to be permanent residuals. Even though things can be made better at any point, there's going to be a lot of residual effect. But you have to know what you're dealing with, and you want to get me cranked up on inoculations. That's a story that we can sit here and talk about for a couple hours. 888-630-9625. Love to talk to you. Let's talk about different things in addition to Bell's palsy and so forth. By the way, when it comes to Bell's palsy, this is the first time it was observed was many, many moons ago. We're going back in the 19th century. First documented case that I remember was early 1920s of that nature. If my brain serves me, and I can visualize the report. But it wasn't until a whole lot later, and I think it was probably a half a century later, 40 years later, something like that. Time travels very quickly. That there was very specific techniques that were developed to retrain, re-educate the muscular patterns. And that is an important piece. If the doctor has not given you facial exercises or toning exercises or strengthening exercises, then you're going to be left with a real problem. You have to get to it quickly. Acupuncture works dramatically. There's very specific nutrients that are used to make a huge difference. But neuromuscular retraining also is important. In any of these cases, if you ever want to just ask the question, call us. We'll give you the data. We'll tell you what we think. And then, we're going to encourage you to, to do your research, your information as much as you possibly can. 888-630-9625. We're talking about a lot of things, and also the fact that I'm going to be down at the Fairview Park Marriott Hotel immediately after the program. Come on down, say hi to me, shake my hand, tell me who you are, and that you've been listening to the program forever, and what can I do to help you. And we want you to know that we're already into 2015. We're scheduling our docs out in a lot of different areas of the community to do presentations and lectures and so forth. If you'd like us to come and present, and these are courtesy presentations, we do them in conjunction with Caring for Others, a 501c3 foundation, as a public service educational format. If you would like to have us come and present to your churches, to your clubs, to your organizations, our docs will even go out if you put together 15, 16 people that haven't heard them before. They'll come out and educate you because they're passionate about what we do. All you need to do is call our office at 703-698-7117. That's 703-698-7117. Ask for either Dareth or Don and tell them that you'd like us to come out to your organization and present. I mean, we have a whole list of things that, we present on, and it's fun. It's it's motivating. We will sit there and answer questions. If we're not on a time frame, love to do it, okay? And don't forget, October 18th, Fairview Park Marriott Hotel again, but that's our all-day event. That's Ageless Health 2014. We're going to come up for a break in about 30 seconds or so. We have a couple people that are online right now. I'm going to take one and hold him over, so don't drop the phone yet. Jerry, how can I help you, sir? We got 30 seconds to find out what it is. I'm going to hold you, and then I'm going to answer your question when we come back.
Hi, yeah, my mother is 87. She faints a lot, and I just heard you talk about the vasovagal nerve getting stimulated. That's what they're saying that is the reason why she faints, and I was just calling to see if there's anything that you can recommend prevent her from fainting.
Well, there's a lot of things I can tell you that need to be done and need to be checked. So hang on, we have to take a break. We'll be right back. Don't go away, and I'll answer your question.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're here every Sunday, 12 noon, same old place on your dial. Tell your friends about it because, you know what, we're talking to about 27,000 people every Sunday, and, I love doing this program because I love getting you interested. The one thing that you have to remember, the rules of the program, again, particularly when I'm here by myself and I don't have a guest, call early. There's 5 of you sitting there right now on the screen, 5, and I'm not going to get to all of you. You got to call early, and I'll talk about anything that you want to talk about, but I'll do my best, and we're going to see what we can do. But you can always get a hold of us through rosellecare.com. That's ROSELLECARE.com, or go to 703-698-7117 and tell my staff that you'd like to talk to one of my docs. If you send an email, I will answer it personally. It takes me maybe a few days to a week, but I will get to you. I promise you I will get to you. Give us a call. Send us a note. Jerry, are you still there?
Yes, I am.
Okay, listen, vasovagal problems are no fun, and they seem to hit people as they get much older, and there's a lot of reason for that, from anything from, they can have problems with vision, they get tunnel vision, they get ringing in their ears, they pass out, they sweat, they get physical weakness, all those things go together, and, the the terminology is vasovagal syncope, and that's that nervous fainting type of feeling, just before people drop and go down. So what are the causes? We only have a couple minutes. It can be triggered by a lot of things, but it's usually a pressure type of sensation, changing posture patterns. Sometimes pain will do it. Quick arousal, startle reflex, sitting on the toilet and either urinating or defecating, that pressure, coughing. All of those things can trigger that. And sometimes foods, eating certain things will trigger it as well. Here's the deal. You see it mostly in older people, although it happens in younger people as well, but the majority are older folks like your mother. And the thing is that over time, our protective mechanism, our fight-flight system, the adrenal glands, small little ductless glands that sit on top of the kidneys, are getting depleted. They're tired. So they don't put out the different hormones that are necessary. One of them is a triggering mechanism to produce something called angiotensin. Angiotensin is a steroid that allows the arteries to maintain tone. If the cervical vertebrae, the neck itself, has degenerative problems and we're getting compression of the skull on the first vertebrae, then what happens is that automatic reflex that controls a lot of things we're talking about at the lower portion of the brain or the brainstem is going to be compromised. So any shifting of activity, any increased pressure is going to cause that neurological signal not to work the way it's supposed to. So what can be done? I don't know specifically what your mother's condition is, but the first thing that I would suggest, broad brush, is that you have to dramatically increase her protein levels and make sure she's eating every couple hours and not just quick sugary types of foods or carbohydrates. And that's difficult as an older person because they begin to lose their taste for the good type of foods and they want the bad types of stuff. Any kind of stimulant should be avoided in the body unless she's been on things for a long period of time, and then we don't want to get rid of that too quickly because she could have a similar type of reaction to that. When we see patients with that nature, we look at the structural pieces. We look at the energetic pieces. Acupuncture works very well into handling that. She's up in Montgomery Village, so she's way north of us. But, Jerry, if I can be helpful, send me a note at rosellecare.com, and I'll see if there's somebody that can help you. Or, I'll tell you what to do. But I really appreciate it. Thanks for your phone call. Friends, call earlier. There's a whole bunch of you sitting there. I apologize. I'm headed down right now to the Fairview Park Marriott Hotel. Meet me down there. Say hello. Let's talk. I think the things I'm going to share with you this afternoon you'll really appreciate and be able to use. Don't forget, Ageless Health 2014. Bye. See you next week. Finding out the Affordable Care Act isn't so affordable that you can't keep your doctor or you have to pay an annual fee just to be a member of a practice? That preventive care really means take this pill for the rest of your life? I'm Dr. Tom Roselle, and one day I will show you how to take control of your health and avoid a lifetime of drugs and probable surgeries. Join me for Ageless Health 2014, a day that will change your life forever. For details and registration, visit agelesshealth2014.com or call 703-698-7117. This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Thank you.